This actually is Epilepsy Awareness Week, and it's kind of ironic that my next guest, which is Mayo Senator Rose Conway-Walsh, is on the line this morning, because for anybody out there who is either bipolar or who is epileptic, there are, I suppose, lots of unanswered questions surrounding the continuing effects of sodium valproate. It's a medication used to treat epilepsy as well as bipolar disorders. However, the European Medicines Agency is now restricting its use in women due to increased risks of disability in children that are exposed to the drug in the womb. Serious issue this. Rose Conway-Walsh is on the line. Rose, good morning.
Good morning, Tommy.
You've been contacted by lots of families.
I have. I've been following this for about 18 months when it was first identified to me by Oaks Ireland and indeed by Epilepsy Ireland, and I want to thank both of those organisations for the work that they have done around this. But it came to my attention that, now the first thing to say is that sodium valproate Epilum is a very effective drug for treating epilepsy and bipolar disorder. It's only when a mother becomes pregnant that the problems arise. And data suggests to us that up to 1,250 children may have been born with valproate-related disability.
Okay, and I want to be very specific here. This data, I mean, data from who?
Yeah, it's very well established. It's very well established by the HSE and all that. And you see, this problem isn't just confined to Ireland. So we've already had an inquiry in France. We have a review going on at the moment in the UK as well. In February of this year, the British Health Secretary, Jeremy Hunt, announced that review around concerns about how valproate was handled in the past.
No, it's just a review, Rose. So,
I know. But I really need to tell you, Tommy, because the figures around it are really established and the evidence around it are really established. And that came to the forefront at the conference that was held last week as well, which was called The Consequences of Sodium Valproate 50 Years On. So you had really eminent professors and doctors there as well producing all this clinical evidence. So, it is very well established.
And what are the manufacturers saying?
The manufacturers knew of the effects of it as well some years ago. And that therein the problem lies as well. They did, and they have said it. And now, I suppose what shows you that clearly is the fact that now the packaging that's been done on this medication, it is showing clearly that it's not suitable for women who are about to become pregnant or who are pregnant.
So what more can the manufacturer do?
Were the evidence not there, then that wouldn't be there. So they are catching up. Now they're catching up, and why they're catching up is that last year there was an Oireachtas committee, health committee, produced a report on valproate syndrome, and then the HSE established the response project group to that. And the first thing they set out to do was to do risk minimisation. So now you have the medication that's packaged and that the warnings are there. Now, I'm still not convinced that all of the GPs and everybody who needs to know has the full information on it. So I still think there's a job of work to be done around that. But the other job of work that has to be done is around finding out who knew what and when. Because it's obvious that if you take this from a timeline from 1975 when it was first licensed in Ireland, there isn't information there on what trials were conducted at the time, and if no trials were conducted, then what clinical trial data was used on the basis for its approval here. So there are lots of gaps in the information. Then beyond 2005, there was absolutely no doubt whatsoever that the impact of taking valproate while you were pregnant, or the impact it could be. We're talking about kind of up to 40% here in developmental disorders and other disorders. So that can be autism, but they're collectively known as fetal valproate syndrome around it. So as the years went on, people became more aware, but that information wasn't disseminated down to the GPs, and above all, it wasn't disseminated down to the mothers. So you have the mothers mothers and the families of all, but particularly the mothers, think of these children and young people who have been born with the disabilities, feeling guilty themselves and questioning themselves of, I should have known, because the fact is that their lives could have been totally different. These children need never have had to experience those disabilities, and their families need never have had to become long life carers for them.
But the drug was approved and obviously prescribed by GPs.
Yes.
So somebody approved it.
Yes.
So I'm quite, I presume that any drug that comes on the market, whether it was in the 70s, 80s, 90s or even today, had to go through fairly rigorous tests before it would be officially approved. Would I be correct?
Well, you would think so, and that's why I believe that we need a public judge-led inquiry into this, because we want to know, as I said there, to establish what we cannot find out what trials were conducted or what the approval process was back in 1975. But it isn't also just that a drug is then approved. See, data is collected all the way along, and so it's not approved and then just left thereafter for nothing else to be done. These drugs are the effectiveness and the side effects of drugs are supposed to be reviewed on a periodic basis, and this doesn't appear to have been done either. So as a result, say, looking at France and what France have done, when they did their inquiry and they established beyond any doubt that what had happened and that the state were negligent in this, they set up a redress scheme as well, the redress scheme that would support these families and provide the services and support for the children and the young people who had been affected. And we need a similar thing here, because French children aren't any different than Irish children. But I just think it's very important that we establish who knew what and when, and whose responsibility it was to prove it in the first place and to make sure that the information was disseminated out, because there's a lot of families left in huge distress.
And I do know finally that Simon Harris told the Oireachtas Health Committee that as soon as the HSE this Valproate response project team had finished their work, he'd consider an inquiry.
No, he did tell me that, because I put the question directly to him, and he said they would. Now, my concern is that this work is going to be ongoing and ongoing and ongoing, so that that's why yesterday in the Shannon I called for him to come in to give an update on it, and also we've written to the Health Committee to get the witnesses in again to see where we're at with this, because what I'm afraid is that the can is going to be kicked down the road all of the time, and the appropriate services must be put in place for these children and families. The other thing, Tommy, I would say is that I do believe that there are other families out there who aren't aware of, or other mothers who may have took this drug and aren't aware that it could have had the impact of their child having a disability.
Do you want to hear from them?
I certainly would like to hear from them, and I know certainly that Epilepsy Ireland would like to hear further from them, and Oaks Ireland as well.
Okay.
But I'd be very happy to hear from them and to put them in touch with the supports and where things are at as they are.
Okay, very good. Rose, I've got to leave it there because we're tight on time, but thanks very much for joining us.
Thank you, Tommy.
All right, take care. That's Rose Conway-Walsh. As I say, it was an approved and prescribed drug, but just be aware of it. And the warning is there on it for anybody who is bipolar or epileptic and is pregnant, that there are warnings on that particular drug.